There are 6 different types of synovial joints in the body: gliding, hinge, pivot, condylar, saddle, and ball and socket. Gliding joints allow sliding movements between articulating surfaces that are flat or slightly curved. An example of a gliding joint is the intercarpal joint. Hinge joints permit movement in one plane only, like the hinge on a door. An example of a hinge joint is the elbow joint, which allows for flexion, movement that decreases the joint angle, and extension, movement that increases the joint angle. Pivot joints permit rotation around a fixed axis, the anteroaxial joint, which allows for left rotation, turning of the head to the left when in anatomical position, and right rotation, turning of the head to the right when in anatomical position. Condylar joints permit movement in 2 planes while preventing rotation. An example of this is the radial carpal joint, which allows for flexion, movement that decreases the joint angle, extension, movement that increases the joint angle, abduction, movement away from the longitudinal axis of the body, adduction, movement toward the longitudinal axis, and circumduction of the hand, when the distal end moves in a circle but the proximal end stays stationary. Saddle joints permit more rotation in 2 planes than condylar joints, but still prevents rotation. The first carpal-metacarpal joint is an example of a saddle joint. Opposition, which involves flexion and extension, is movement of the thumb towards the palm or pads of the other fingers. Abduction, movement away from the longitudinal axis of the body in the frontal plane, and adduction, movement toward the longitudinal axis of the body in the frontal plane. The last type of synovial joint in the body is the ball and socket joint, which permits movement in multiple directions as well as rotation. An example of a ball and socket joint is the glenohumeral joint. Ball and socket joints allow for flexion, movement that decreases the joint angle, extension, movement that increases the joint angle, hyperextension, movement past the anatomical position, abduction, movement away from the body's longitudinal axis in the frontal plane, adduction, movement toward the body's longitudinal axis in the frontal plane, and circumduction, which is a circular motion involving flexion, extension, abduction, and adduction.